Good afternoon, everybody, and welcome to this IMI webinar on the rules and procedures for our calls for proposals. My name is Catherine Brett, and I'm going to be starting today with a little introduction on how to use GoToWebinar and to the current calls that we have out. And then my colleagues Magda Gunn and Fabrizio Federici will present our rules and procedures in some detail for you. At the end of the webinar, there'll be plenty of time for questions and answers, and in a moment I'll explain how you can ask a question to us. So firstly, how to use GoToWebinar. At the top right-hand corner of your screen, you should be able to see the control panel. You can expand and minimize it, you can make it go full screen, and you can attract our attention by raising your hand by clicking on the raise hand icon. If you want to listen in via your computer's microphone and via your computer speakers, just select mic and speakers in the audio panel, and if you can't hear us, make sure your speakers are switched on and do a sound check to make sure the system is picking up the right speakers. For those of you who want to listen in over the phone, you just select telephone and dial the numbers given. If you want a number for a different country, or if you're having some problems, you can find other numbers under the additional numbers link. So the most important thing for most of you is how to ask questions. The simplest option is to type your question into the question panel and hit send. You can send in questions at any time during the webinar this way, and we'll take them all at the end. If you want to ask a question over the phone, then you can do that by clicking on the raise hand icon. So before we get started officially, just to let you know, we are recording this webinar and we'll be publishing it and the presentation on the IMI website later. And we will not be circulating a participant list for this particular webinar. So, as you know, we have just launched our 7th and 8th calls for proposals under IMI2. The core text and documents are all available on the IMI website. As we will explain later, reading these documents is really a very good idea. You can see all the deadlines there as well for you, and we are also running webinars on all of the topics. Some of them have already taken place. There are a couple still left, and you can find all the presentations on our webpage, and if you want to sign up to some of the forthcoming webinars, you can do that there as well. Here is just a list of the topics. As you can see, we have things on drug safety, Alzheimer's and Parkinson's diseases, neuropathic pain, age-related macular degeneration, and a kind of preclinical platform for children with cancer for pediatric research there. We also have 2 topics under our Big Data for Better Outcomes program. One is the coordination and support action for the whole program, and there's another project there on heart disease. We've also, of course, launched an open call for proposals on Ebola and related diseases. The webinar on this call has already taken place. There are some small differences between the way this call is being run and the way a standard 2-stage call is run. The webinar for that has taken place, and you can find the recording online, and if you have any questions on that, we can, of course, take those today as well. So on that note, I'm going to hand over to my colleagues, to Magda and Fabrizio, who are going to present the rules and procedures for you.
Hello everyone, and welcome to this webinar. I will start with the brief introduction of IMI overall. Then I will hand over to Fabrizio for participation, funding, and intellectual property rules. Then it will be back to me for some details on how do we get from the call to the grant award, as well as tips on writing successful proposal and other relevant information. So about IMI. First of all, just a brief slide to introduce to you why IMI was created. So of course, medicine's development is very challenging, long, and expensive process. And there's many challenges that pharmaceutical industry is experiencing that leads to many failures in drug development process. And this is very problematic because in the end, patients who are in need, in fact, they do not receive appropriate treatment. Therefore, a decision was made some years ago when IMI was first created that we, in fact, need to make some progress, and the companies alone, they cannot do it by themselves. So they are ready to collaborate with one another, as well as the experts from the field, from academia, research organizations, SMEs, and so on. So that's why IMI was created. Some key concepts of IMI is the non-competitive collaborative research. So basically IMI goes into fields where it is possible to collaborate. It is possible for the companies especially to collaborate where there is no competition, where they can prepare the ground for some competitive development later on. However, to find partners for them, for these projects, we do run competitive calls for proposals, such as calls 6, 7, and 8. We very much facilitate and advocate open collaboration. So, of course, data sharing, dissemination of results is very important. And also important aspect is that industry who participates to our projects, they do not receive any funding. They actually contribute, they invest in our projects, and their contribution is mostly in kind, which means they provide personal resources, sometimes other resources such as compounds, samples, data, and so on. Now, in terms of the budget, you can see the breakdown here, and this shows you the budget for the IMI2 program, which is part of the Horizon 2020 program. We have the funding from the European Commission, which goes to the public eligible beneficiaries, so universities, SMEs, mid-sized companies, patient groups, and so on, and this is 1.638 billion euros. Then the contribution from the private part is largely coming from EFPIA, so this is European Federation of Pharmaceutical Industries and Associations. This is to the order of 1.425 billion euros. There's also a pocket reserved for any partners that would like to associate with IMI and also contribute funding. These could be other non-EFPIA companies, any companies relevant to IMI such as ICT, diagnostics, and so on, but also foundations such as the GDRF, Helmsley Trust, or Gates Foundation. These are so far the examples of associated partners that we've had at IMI. So this brings us to the total of 3.276 billion euros that's available for the whole program until 2024. In terms of what kind of topics IMI is cover and will be covering, they're mostly described in our IMI strategic research agenda, and those priorities have been fully aligned with the World Health Organization priorities. So of course we have antimicrobial resistance, osteoarthritis, cardiovascular diseases, diabetes, neurodegenerative diseases, psychiatric diseases, respiratory, and so on. So all of those quite burdensome and diseases where treatments are lacking or inadequate are included. In terms of prioritization of those different themes, we have several priority areas, and these are described here. So neurodegeneration, and immunoinflammation, metabolic disorders, including diabetes, infection control, and translational safety. Then we have many support technologies that we focus on, of course, imaging, ICT, and medical devices, but also, not to be forgotten, the enablers that will make it possible to really go into precision or personalized medicine. So all those different aspects you can expect that will be addressed in one way or the other in most of our calls for proposals. In terms of how typical consortium at IMI looks like, of course, you have a team of different pharmaceutical companies, and these companies declare their interest and, in fact, define the problem that we would like to address at the topic generation stage. So typically you have several pharmaceutical companies participating, and sometimes also associated partners. It depends on the call topic. And they are joined by the consortium that is selected during our competitive calls for proposals from the public side. So as I mentioned previously, of course, this will be largely academia, hospitals, other research organizations, but also very important small and medium enterprises, patient organizations, and regulators. Just to give you a flavor of what kind of distribution of different teams we have so far in IMI, it looks like this. As I said, largely academic and research teams, complemented by quite a few different teams from industry. But also we're very proud to have quite many biotech companies, so SMEs, and patients and regulators on board as well. So just to make sure that all the relevant stakeholders are participating in our topics. Now I will hand over to Fabrizio Federici for participation, funding, and IP.
Thank you, Magda. Good afternoon, everybody. So let's go through the participation rules to IMI2. For those who are familiar with IMI2, with IMI initiative in general, they may know that under the IMI was established under the 7th framework program, and at that time we were a separate and independent legal framework. Therefore, we had at the time our own rules for participation, rules for submission, etc., etc. However, when establishing the H2020 framework program, the legislator decided that all initiatives which will be funded under the framework program should abide to the same set of rules. This is the reason why today the IMI2, like any other initiative, like other GEUs, will be subject to the, as far as possible, to the rules for participation of H2020. However, in our case, IMI2 has got a derogation concerning eligibility for funding and intellectual property rights. We will look at them in a second. In this specific call, you will find at the very end of the call topic text the specific condition for participation in this call. These are, as I said, they reflect most of the rules for participation of H2020. However, there are some specifications which are only linked to this IMI2 call. As a general principle, the minimum condition for participation is minimum 3 legal entities established in the EU member state or associated country, and should be different states. So it should be 3 entities from 3 different member states or associated country. The call, as already presented, is a 2-stage, means that stage 1 short proposal will be submitted normally from applicant requesting GU funding, and at stage 2, the first ranked proposal will be merged with the pre-established industry consortium. And in that respect, it's important to know that the evaluation criteria, Magda will go through in a while, are different between stage 1 and stage 2. So not all the evaluation criteria of stage 2 will apply at stage 1. The submission deadline is clearly indicated per stage in the call topic text, and there you will also find how the maximum amount of DGU contribution available under each topic and the associated estimated industry contribution under a given topic. I would like to stress this moment that you may be invited during the stage 2 evaluation process to attend to a hearing if so is decided by the evaluation panel. A hearing means that the coordinator of some proposal may be invited to respond to some specific questions raised by the evaluator panel. How this is work? Normally, by the time, with the acknowledgement of receipt of your short proposal, of the submission of your proposal, you will receive a confirmation email from the IMI office, and in that case, we will alert you on which day you may be contacted and when you will receive the related question. So please make sure that the contact details presented in your short proposal in the IT tool when submitting your proposal are correct, because the IMI office only will come back to the coordinates of detail indicated at the time of the submission. But be aware that it doesn't mean if you're not invited to a hearing, does not mean that you score too low to be selected. The point is that during the review process, the panel may decide to invite applicants for an hearing in order to clarify some aspect of the proposal. It may be possible that the panel has no question on your specific proposal, and in any case, consider your proposal valuable to proceed to stage 2. So this is just for you to be aware that there is this possibility, and in order to be invited to this hearing, you should make sure that all contact details indicated at the time of submission are correct. So who can participate in our call? We always say IMI is an open initiative, so anyone, any organization and legal organization can apply for, can be part of an applicant proposal. And this regardless their place of establishment. So it means we can involve any organization, also outside the EU member state or associated country. However, this does not mean that every type of organization can receive GU funding. As I said at the beginning of my presentation, there is a derogation for IMI2 regarding the eligibility for funding. Only certain type of legal entity are entitled to receive GU funding. What are this kind of organization? Are academic institutions, so university, research organization, small and medium enterprise, and no-profit organization. Obviously, this organization need to carry out activities which are relevant for IMI-GU and are relevant for the specific topic you are applying to. But one additional condition for this type of organization is that they need to be established either in a EU member state or associated country. These mean that third country organizations are in principle not eligible for GU funding. They can be part of an applicant proposal, but they can in principle not requesting funding. However, and here we have an exception, we can accept to fund third country organization where their participation is deemed essential for carrying out the specific action. As you can understand, this is an exception and therefore is subject to a restrictive interpretation, and this is done by the panel during the evaluation of your short proposal. And in order to do that, please make sure, if you intend to involve third country organization, that in your short proposal, you clearly identify and justify why the participation of a third country organization is necessary and why this organization therefore should receive GU funding. So just to summarize, what we expect at stage one of a two-stage evaluation process. As I said, stage one is normally to select the applicant consortium. Is the very competitive step where applications of short proposal are presented by a consortium composed by fundable legal entity, which are those organizations I just mentioned earlier, which are eligible to receive IMI funding. But this does not prevent any other organization which is not eligible for receiving GU funding can be part of the same proposal as far as it's carrying out activities which are relevant for the proposed project. Then the first rank at stage one, so under each topic will be a ranking, and the first rank proposal, the first rank consortium will be invited in preparation of stage two to submit a full proposal together with the industry consortium, which is pre-identified associated to that given topic. The industrial consortium is identified, so each individual company participating under a given topic are spelled out in the call topic text under the relevant topic. Let's see how does it work, IMI? How is the funding of IMI working? So as we said, IMI is a public-private partnership. Therefore, there are two sources of funding or two sources of contribution which coexist normally in an IMI project. On one side, we have the GU funding, as I said, which is allocated to beneficiaries receiving funding, which in other words are those who are eligible to receive IMI funding. However, this funding is complemented by in-kind or cash contribution, which is provided by beneficiary not receiving funding, which in a classical IMI project are FPA companies, so FPA company member of the FPA association. Some cases we can also have associated part to the IMI-GU, or any other additional entity. For beneficiary receiving funding, we are fully aligned to H2020, and here we have one single reimbursement rate for all beneficiaries and all activities. So this is not anymore like in FP7 that according to the type of entity and according to the type of activity, you have different reimbursement rate. In this case, under this call, the reimbursement rate is 100% of the eligible cost plus the 25% flat rate for indirect costs. And this GU contribution cover personal costs, equipment, consumable, subcontracting, etc., etc. Obviously, subcontracting should be identified in the description of the action and in your proposal if you already identified them in the proposal. And costs will be claimed according to the accounting management principle of each applicant organization. However, within the framework of the IMI2 GU, beneficiaries receiving funding can also receive financial contribution from FPA companies, and this is what we call the financial contribution. In that case, this is possible. Normally, if it happens, is discussed in preparation of stage 2. It's normally within the estimated in-kind contribution, which is identified in the call topic text. And during the project implementation, this financial contribution should be reported or must be reported by the beneficiary, the recipient receiving beneficiary receiving funding, as a receipt. How they contribute the associated partner and the FPA company? As I said, they are organizations which are contributed in kind, so they are supporting their own cost in participation in the action. Then it can be FTE rates or staff allocated to the project, can be cost for consumable, can be cost for equipment, and these are reported to the GU based on their usual management accounting practice. But they can also, as I just said, contribute directly, providing financial contribution to other beneficiaries. So basically, outsourcing an activity in beneficiary receiving funding, which will receive the necessary financial support by the FPA company. As again, here, as I said, this will be reported on one side by the givers, so by the FPA company, which is allocating a financial contribution to beneficiary receiving funding, and will also be reported to the GU by the beneficiary receiving funding as a receipt from the FPA companies. For your information, FPA companies are allowed to include in their proposal or in their project non-EU in-kind contribution, which in other words is a work carried out outside the EU member state or associated country. They can, for instance, contribute with companies which are based in the US, in China, in India, wherever. However, at program level, there is an overall ceiling. The non-EU in-kind contribution cannot be above 30% of the total in-kind contribution allocated under at program level under whole IMI2 GU project. And another element is this non-EU in-kind contribution should be justified and in line with the IMI objective. It's also important to know concerning the participation of FPA companies that their financial reporting is not anymore linked to the consortium report for scientific report and financial report for beneficiary receiving funding. There is a disconnection. FPA company and associated partner will report once a year by January 31st every year for all the projects they participate under IMI-GU, while the beneficiary receiving funding, they will report once a year, but according to the grant agreement project deadlines, and this happens in this connection with this financial reporting for FPAs. What does it mean? It means that each project will report once a year according to the project deadline from scientifically, so the scientific report, this is the full report for all participants, FPA and beneficiary receiving funding, but only about science. And then for what concerns financial, the financial reporting for the beneficiary receiving funding will come together with the scientific report, while the financial report for the beneficiary not receiving funding, which are FPA or associated partner, will come by January 31st every year about the previous year. And then by April 30, they have to provide a certification on their cost. While the beneficiary receiving funding will have only to provide a certificate of financial statement if their contribution is above 325,000 euro at the end of the project. So as you can see, there is a quite big difference between the reporting obligation, the financial reporting obligation between FPA companies, which are not receiving funding, and all the other beneficiaries which are receiving GU funding. And then now let's have a look to the IMI IP policy, which is the second derogation I mentioned on the H2020, and is it's one of the key points of the IMI2. The IMI IMI2 IP policy is based on the IMI1 IP policy, which already allowed for an unprecedented level of sharing and was essential to the IMI success. This is a policy which address and protect the interests of the different parties which are involved in the IMI action. And this one to ensure a rapid uptake of newly developed technologies, methods, and standards into industry and regulatory practice. It's important to note that this is a minimal provision which cannot be set aside or restricted any further. You must apply it, but you can expand it. So when we talk about access right, you may decide to give more access rights, but you cannot give less access right to the beneficiary of third parties. But let's try to have a look to the main concept of this policy. First of all, we distinguish between background and result. What is background? Background is any information which is provided by the participant to the project and which is necessary for the project implementation. Background is information which are owned by the participant before the project starts and should be identified in the consortium agreement. While result is any output of the project, so any output of the project which is generated during the duration of the project and which fall under or within the project objective. And this is very important to differentiate from side ground. Side ground, again, is any output of the project but which fall outside the objective of the project. So as you can understand, the difference between result and side ground is linked to the project objective, and I can tell you that result is covered by the IMI IP policy, while side ground is not, which means that the minimal provision applies to result, but they do not apply to side ground. So in order to avoid a future legal dispute, it's very important to draft clearly what are the objective of the project, because if then something fall under the objective of the project is result, so it's covered by the IMI IP policy, while if it's fall outside the scope of the project objective, then it's side ground, and then there is no the minimal provision applicable to this information. And it's important to stress, because in the past there was some misunderstanding, that participation in an IMI action doesn't affect ownership. So you will remain owner of any information you bring to the project, so for any background you bring into an IMI project, and you will be the owner of any result or side ground you generate into the IMI2 project. However, and this is based on your contractual freedom, you can decide at some point to license or transfer your IP. So this doesn't mean that if you are the owner of the result, so if you are the one who generated the result, then you cannot at some point decide to transfer this result. But the rule is that you remain the owner of what you own or what you generated. And in that respect, under IMI2, we also have the concept of joint ownership, which is a concept which is stemming directly from the H2020 rules of participation. And we talk about joint ownership when some results are generated by more than two or more participants, and their contribution cannot be ascertained. Joint results can only be transferred once they are generated. They cannot be pre-assigned before the generation. This is very important in certain type of project. And additionally, we always suggest or advise that the key point on joint ownership are already identified in the consortium agreement. Because if you wait to have joint results to address the content of the joint ownership, you may run into problem. You really to establish as soon as possible the key point on how to deal with joint ownership, because then when you will have when the joint ownership happen, you already have a set of rules can be applicable and to avoid legal disputes. And here we come to another key concept of this policy, which is the difference between research use and direct exploitation. Research use is identified, is anything which is not project implementation and direct exploitation. In other words, it's the use of your result of the background necessary use of the result for all purposes which is not in relation to completing the action, so achieving the project objective, or direct exploitation. What is direct exploitation? Direct exploitation is simply to develop for commercialization, to commercialize something, to commercialize your result. So we say the IMI2 policy, the key point of the IMI2 policy is research use. No question that you need to give access to your peers, to the other participant, to your background or to your result if they need them to implement the action, because you are directly concerned, the entire consortium to achieve the project objective. But you may be requested to give access to your result or to your background, not only for achieving the project objective, but to do something else. And you are obliged to grant access as far as this is for research use. And this is clearly stated in the IMI2 policy. Well, you are not obliged to give access if another participant is requesting you access to your background or to your result because you want to commercialize this result. In that case, direct exploitation is not covered by the IMI2 policy. Here you have a table when you can summarize the access right condition, and you can really see that beneficiary has a royalty-free access to background necessary to use the result and result if these concern completion of the action. While when we talk about research use, we talk about fair and reasonable terms. Fair and reasonable terms can be, but not only financial terms. So it can consist of financial terms, but it can also be something else. And these fair and reasonable terms also apply to third parties for research use. So third party means that the organization which are not beneficiary in this action, but this apply only after the project ends. While, and you see at the very bottom of this table, beneficiary and affiliates or third party, they can apply, but they have no right to get access for direct exploitation. This is negotiated case by case. So you are free, if you are the owner of some result or somebody requests of access for direct exploitation, then in that case, you are completely free to negotiate as you see fit. And here we come to another important point. We mentioned access right to third party. Access right is only to third party happen only after the project ends. So after the project ends, you may be requested from a third party to give access to your result for research use, here again, at the fair reasonable terms. And in this case, you should allow this unless this has been excluded at the beginning of the project, and this is subject to an exception and should be accepted by the IMI office. So you should give this access, but this access can be requested only within certain time limits. These time limits have to be agreed upon by the consortium itself in the consortium agreement and should be communicated widely in order to make aware any potentially interested third party about the time limit. So potentially interested party should be aware that they have a certain time after the project ends to request access to the result of a given project. Normally, these time limits are agreed in relation to the type of the action, the expected result, and the likelihood of applicant organization for this access right. This was a brief description of the IP policy of the IMI2. If you need any further detail or you want to have a look to the legal provision, which are the base for this presentation, I can invite you to refer to the H20 rules of participation. However, as I said, this policy has been derogated, and the specific IMI2 IP policy are contained in the Commission delegated regulation on the IMI2, where the specific provision, which then have been the legal base for the policy, which is enclosed in the model grant agreement, the Article 23A to 31 is included. So basically, the IP policy I just described is the one identified and established by the IMI2 model grant agreement. Very soon, hopefully, we will be able also to publish an IMI2 annotated model grant agreement, similar to the one which is done in the H2020, which will contain some specific annotation under the key article for IMI2, so where the article of the model grant agreement differ from the H2021, and in particular, one key section will be the IP section in the annotated model grant agreement, which refer and explain more in detail what I just mentioned. I give back the floor to Magda, which will provide you some more information about the evaluation and award process of this call.
Thank you very much, Fabrizio. Okay, so first of all, I will cover the IMI project life cycle, starting from the call topic definition, and then call launch, evaluation, and then grant agreement. So just to briefly tell you how our topics are defined. Of course, as I mentioned before, the agenda, the scientific agenda of IMI is described in our the document scientific research agenda, but this describes the overall topics in quite broad terms. Much more detail then is included in our annual work plans, and there we include scientific priorities that we plan to cover during each year, even to such detail, if we know it, of which type of calls we are planning to launch. In terms of who is involved in shaping those calls, mainly the ideas come from the industry because of the reason why IMI was created. It was created to help industry overcome some of the key difficult barriers in drug development process. So they are the best positioned to actually tell us which are those key issues, key challenges that they need input from the broader scientific community. So they more or less define the problem statement, and perhaps put some ideas down on how this problem could be addressed, what kind of expertise is required, and so on. This happens to some extent in strategic governance groups, at least for the 5 priority areas that I previously described to you. We have 5 strategic governance groups, which are composed of representatives of different pharmaceutical companies which are interested in the given area, for example, neurodegeneration or diabetes and so on. So those groups meet quarterly and they discuss the whole portfolio of IMI in their given disease area and what they would think would be the next step to move the field forward based on what was already achieved and delivered and what are still gaps remaining. Once the topic is drafted, it goes through consultation with our member states as well as our scientific committee, and sometimes it even goes for consultations with regulators such as EMA. Finally, the call is approved by our governing bodies, so the European Commission and EFPIA, and then it is launched. So this figure shows you more or less how the whole project, the evaluation cycle goes. We go from topic definition, which I just described to you. We launch the call, and at stage 1, we expect applications from the public consortia. So there, all those different participants come together in a consortium, and the key point is that yes, the eligibility criteria is 3 legal entities, but the number and the type of participants is more or less defined or dictated by the requirements of the call. If the call for proposals is very complex, it covers many different areas, many different expertise, then you will need participants from many different disciplines to cover all the different relevant requirements, because the key is to address all the objectives stated in the call. So that we often receive questions, how many participants do we need, and so on. The answer is in the call topic text, because you need to make sure that you have all the relevant expertise to address the objectives listed in the call topic. So once we receive the applications, they go through independent evaluation by independent experts, which we select based on their expertise relevant to the call topic. Typically, there are 5 or more experts in the panel that evaluate the proposals, and only one of them is selected to go forward. So this is quite a competitive process. We don't receive many applications. We don't receive tens or hundreds, like sometimes it happens for the Horizon 2020 program. But what we do receive, they are quite good, strong, and very competitive proposals. So this selected proposal then is invited to stage 2 to prepare the full proposal, and there they join with the pharma companies who originally committed to the given call topic text. So at this stage, the contributions from both public and private need to be much more elaborated. Basically, the two sides need to merge into one well-coordinated and well-balanced consortium with quite detailed project plans included in the full proposal. This proposal is again evaluated at stage 2 by independent experts, and typically the expert panel remains the same. However, in the second stage, of course, there's no competition anymore. There's only one proposal, and the criteria there are much more focused on the implementation of the proposal to make sure that it is well elaborated and described, and it makes sense to indeed fund it in the end. So as long as the evaluation is positive, the consortia received a green light to enter into grant preparation phase, where they discuss their project agreement, and eventually they sign the grant agreement and the project starts. So in terms of evaluation criteria, they are the same for the moment as Horizon 2020. We look at excellence, impact, and quality and efficiency. We typically have two-stage evaluation, as I described to you. However, sometimes we do have one-stage evaluation, and I think this will be the case for the Call 8 proposals. So then this is a little bit different. Each of the criteria have thresholds, and all these details are described in our call documents if you are interested to look. As I said, we have typically 5 or more experts, even though the minimum criteria is 3. However, since our call topic texts are quite complex, we want to make sure that we cover all the different types of expertise. And of course, each proposal is evaluated as is, and not as it could be if some recommendations were made. So it is very important to elaborate all your ideas and how you would like to achieve the objectives listed in the call topic text in your proposal. So it provides sufficient information for the experts to evaluate it. In terms of some detail on the evaluation criteria, and also all this information you can find on our website in the call documents. For each criteria, there is a list of sub-criteria which provide more guidance for the experts on how to evaluate. The bullets in green are only relevant for stage 2. The ones in black are for both stages. So, for example, for excellence, we will look at clarity and pertinence of the objectives, credibility of the approach, soundness of the concept, also transdisciplinary considerations, and so on. So please, it is important that you read these criteria, because then you will know on which basis your proposals will be evaluated. The same goes for impact. You see here some of the sub-criteria apply only in stage 1. So this will be the bullet 1, 2, and then 5 and 6. The bullets 3 and 4 apply only at stage 2. And then criteria 3, in fact, the whole criteria 3 only applies for full proposals only. So this is when the project plan is much more elaborated, and it is indeed possible to evaluate all these different aspects. We try to keep our time to grant up to 8 months, and typically we are able to do that. There is no problem. We stay within 5 months for informing the applicants of scientific evaluation from the time the full proposal was submitted. And then typically it takes 3 months to prepare the project consortium agreement and the grant agreement. To speed up the process, of course, we try to validate legal entities in parallel. In terms of the IMI grant agreement, we follow the model of the H2020, but with some IMI specificities. And as Fabrizio told you, the annotated grant agreement should be available on our website soon. And this is where some of those specificities are elaborated. The grant agreement is signed between IMI and the coordinator only, but all the other beneficiaries sign the accession forms. The FP and associated partners are listed in the grant agreement as beneficiaries not receiving funding, so Article 9, and their financial reporting is outside of the grant agreement, and this was already covered by Fabrizio a little bit earlier. In terms of consortium agreement, this is actually an agreement which is negotiated and signed between all participants. IMI does not interfere with this agreement unless some kind of guidance or advice is needed. But this agreement sets out all the partners' rights and obligations, the governance of the project, the liability, and especially the IP rules. So, of course, it has to stay within the rules of the grant agreement, and typically, IMI will not sign the grant agreement unless we have sufficient assurance that the consortium already has agreed on their consortium agreement. And of course, the consortium agreement is slightly adapted between different projects because it depends if a project is involving clinical trials, then consortium agreement will be a little bit different. If it's mainly focused on basic research, then the consortium agreement might be a little bit more straightforward. So that's why the specificities are included there. Now we will move on to some tips for success when you apply for IMI projects. This is based on what we've seen so far in previous IMI1 and IMI2 calls. So, of course, you have to be careful to make sure that you meet admissibility and eligibility criteria. One of them, an important one, is the deadline, and you might not believe me, but there are too often, unfortunately, cases where people try to submit the proposal at the last minute or the last second, and they don't make it. So please give yourself enough time, because that will be a shame if you worked so hard and then you missed the deadline. Proposal out of scope, we don't see that too often, but sometimes we do, and only when it's really extreme case. For example, we see a proposal for an aircraft carrier for Ebola project. Of course, it's out of scope, but we try to be as much inclusive as possible. A minimum of 3 legal entities, that's a very important criteria, and of course, if this is not fulfilled, your proposal will not be eligible. Other common mistakes, and these then are addressed during the evaluation by independent experts. If your proposal does not address all the objectives, sometimes we see proposals which address, let's say, 80% of the objectives. So this already puts you in a vulnerable position. If there is another proposal which might not be as good as yours on some aspects, but it addresses all the objectives, it is automatically looked at as more favorable. So be sure to address all the objectives and be sure that relevant expertise is on board. Also, you have to make sure that your proposal respects the proposal templates. That is very important. As I mentioned, the relevant expertise with the capacity to address all the objectives needs to be included, being careful also not to have redundancy between partners, because it is very important to distribute the budget carefully between different partners and only have the relevant people on board. Make sure that you think about the impact of your proposal, because sometimes excellent and very groundbreaking science might not be appropriate for a particular topic. Please ensure to look at what are the key deliverables that are expected from a given project, and make sure that you elaborate how your idea will contribute to those expected deliverables. And this is much more important for the second stage, so for the full proposal, but ethical issues have to be addressed appropriately in the proposal. If I had to give you some tips, of course, the obvious one is to read all the call relevant material, and that means not only call topic text, but also the other material that's available. There you will find all kinds of different information and advice. Understand IMI rules, so you're already working on this by participating in our webinar, so that should give you a lot of insight on how this works. If you have any questions, please ask. We are available to answer any of your questions, either on the rules or on specific scientific questions regarding the science. You can always contact us by emailing the info desk, and your email will be forwarded to the appropriate person. So once again, the short proposals are very short. There's only 15 pages, and you have to be very strategic about the information that you provide, that it's enough for the reviewers to actually assess your proposal and to differentiate your proposal from others that might be submitted. Start working early, of course. We try to publish the materials even before the call is launched so that you know what's coming and you can already start networking, start planning, and thinking about what your proposal will look like. Of course, finalize and submit your proposal. In IMI, our system is a bit peculiar that you have to actually click twice. You have to finalize, and then after it's finalized, you have to submit. So please don't miss that, because if you do, we will not see your proposal. There are even more tips on our website, so you can peruse the link that's provided here. In terms of submission, we are using our own submission tool. It is called Sophia, and you can see a screenshot here. But you can also access our portal via the participant portal on the European Commission website. So it should be quite easy to get there. If you are looking for partners, you can try to use our partner search tool and advertise your interests, but also try other possibilities, other platforms, for example, Fit for Health or different partnering platforms on country-specific, for example. But most of all, try to engage with your scientific networks. And if you are not directly in a given field, you can always try to contact people that are strong in a field, because very often we see those really key, strong scientific players in our project. So you can find them by looking into publications, or you can find them by looking into related IMI projects from the past. More information can be found, of course, on our website. We are also very active on Twitter and LinkedIn. We have a newsletter which you can subscribe to, and of course, as I mentioned before, you can email us with any questions that you might have. Your contact point is, of course, the info desk. In case of IP queries, there is an IP help desk. You can also contact your state representatives, which we have representatives for each different country in Europe. And there's also Horizon 2020 NCPs, national contact points. So all these different people might be very useful when trying to prepare and submit proposals. Now I think it's time for any questions that you might have.
Thank you very much, Magda and Fabrizio. So yes, it's now over to you, wherever you are listening into this webinar. As I said earlier, you can ask questions in two ways: by typing your question into the questions panel and hitting send, and some of you have already done that. And if you want to ask a question over the phone, you can raise your hand to attract our attention. We do actually have some questions that have come in by email, in fact. And the first one, which I'm going to take, and there's also a question on this that has come in during the webinar, is the role of US entities. Some people are pointing out that US legal entities do get funding in the 2016 to 2017 Health Societal Challenge in that work program. Is this also true for IMI Calls?
No. So, as I mentioned in one of my introductory slides, and the IMI2 does not apply the same condition as the H2020. So SC1 the condition of C1 does not apply to IMI entirely, which means that our case, only organizations established in the EU member state or associated country are eligible for funding, and provided they have the legal status mentioned in that slide, so academia, small and medium enterprise, mid-sized cap, etc., etc. However, in some exceptional cases, we can have third country organization, but this is to be assessed case by case and should be essential, should be deemed essential for the carrying out the specific action. That's why I stress that you should make your case in your proposal and mention why a third country organization from a third country should definitely participate and be eligible for funding, because this is subject to evaluation of the panel itself.
Okay, and another kind of follow-up question to that, if US-based applicants can apply, does the proposal also have to have a European component to it?
Yes, for sure, because as we said, the minimum condition is 3 organizations from 3 different member state, EU member state or associated country. This is the main criteria. So proposal which not include at least 3 organizations from associated country, EU member state, are not eligible. They would be rejected at the very beginning of the evaluation process. So even if you have an organization from third country, you must have 3 organizations from the EU associated country.
Thank you. There's a couple of questions about the budgets and the timelines of the topics. So what should the budget limits be for any individual proposal? I mean, it's set out in the core text, actually. In the core text, each topic has a budget, and there is an IMI part and an FPA part.
Yes, so that doesn't limit you, so to speak. If you would like to have a bigger budget, you can, but the limit of how much of your budget will be reimbursed by IMI contribution is listed in the call topic text. So if the text says that there's only 10 million euro IMI contribution, that means that only 10 million euro will be eligible to be refunded, so to speak, by IMI. So if you have other costs that go beyond that, you will have to cover it by your own contributions.
Exactly, and just to be very clear, the FPA contribution, that is actually the FPA contribution in kind, so that's not funds that are also accessible to the other applicants. IMI works by funding the universities, the SMEs, etc., and the FPA companies effectively fund their own participation. So just to be clear on that. And a similar question also.
If I just may introduce on this, it's very important that you really assess the requested contribution against what the work you want to carry out. So just not claim or request the indicative, the maximum GU contribution, because the expert will assess at stage 2 that the requested contribution is in line with the project activities. So don't overstate or not over budget your proposal. Really request the budget necessary for your activities.
Okay, and also related to this, what are the time limits of the proposal, and what are the yearly allowable budgets? I mean, the duration of each project, again, is set out in the full text.
Yes, it's defined in the call topic text. And then in terms of yearly allowance, there is no such thing.
No.
What happens when the project starts, the project receives pre-financing, which is more or less equivalent to
one reporting period.
Yeah, about cost of 1 reporting period. So it would be the budget divided by number of reporting periods, so number of years. And then every year when the project reports the costs that they incurred during a given year, once those costs are accepted, they are reimbursed, so based on the actual costs. So there is no limit. Besides the fact that IMI reserves 10% of the total budget of the project till the end of the project, till the submission and acceptance of the final report. And also, I think there is a little bit of the funds, perhaps 5%, that goes to the, now I don't remember the name, but goes to the
H2020 guarantee fund.
Yes, to the guarantee fund. This is to protect ourselves in case of bankruptcy or any kind of problems. So I think up to 85%, all these costs will be reimbursed on annual basis based on what is reported in the periodic reports.
Thank you. And some other questions that have come in via email. One was about the intellectual property status of contributions from academic partners. I think Fabrizio has gone into the IP policy quite thoroughly, so I'd say if that didn't answer your question, send some other ones in, or if you request the clarifications. One question we have, is there a maximum percentage of funds allocated to a single country within a single project, as was the case for some FP7 projects?
No, there is no minimum. Again, the minimum criteria is just that you need to have 3 organizations from 3 different countries, which are EU member state or state country. Then the budget allocation is, it should be, it's done by the consortium. However, it's important. Our experts, when they review proposal, they may consider the allocation of tasks and therefore the allocation of budget within the consortium. If you then have all the activity which is concentrated in one single participant, they may question how sound is this proposal, which is fully focusing on one single participation, despite there are 3 participants. So it's up to you how you describe this activity, and you should make your proposal as a real collaborative proposal. But again, this should be in line with the activities and the objectives of the proposed action.
Thank you. Going to the questions that we've received today in the webinar directly, earlier Rita Hemelainen asks, if a team, for example, academic, finds out that the call has the perfect match to their research, what is the best way to continue the process and how do you get the best partners? Magda touched on this. The best thing to do is to use your personal contacts. There is actually a whole page of advice on this in the IMI website. If you click on partner search on the homepage or from the call section, you really need to look at the call text, see what is, all of the call topics, it does say very clearly what is expected of the applicant consortium. So see what you can bring to that and then what you would need to match with and really contact the people. There are tools, there's social media, there's the IMI LinkedIn group, but it's really the best thing you can do is use your personal network.
Yes, and I think to complement what Catherine said, you have to make a decision whether or not you would like to lead the proposal, because you can take the leading role and become the coordinator of the project and then try to assemble the consortium. So try to find all the different partners that will help you address all the different objectives of the call. If not, if you would not like to do that, then you would have to try to find who is already preparing the proposal and how can you join it. And this is when you try to contact people, reach out to relevant experts in the field and kind of sell your contribution. So you would have to describe what is your area of expertise and how you would contribute to the given proposal, what is your strength and why they should actually consider you as a partner. So it is not easy if you don't already have a network or if you don't already have potential partners, but that doesn't mean that you shouldn't try, and you should try as early as possible.
Another question from Joanna Stewart. This is one question here. So for a stage 1 proposal, the form states that the estimated cost for a proposal must be greater than the requested IMI contribution. What does this mean?
I'm wondering, where did you take this? Because this seems to be from IMI1, where indeed we were not reimbursing the entirety of the cost, but we have a 75% reimbursement rate for LTD activities, while now under H2020 we have a 100% funding rate. So I wonder if this is in Sofia, so in the IT tool application, there may be something which has not been updated. I will check, but so I would say that today proposal at stage 1, since they are just applicant from eligible for funding, could have the same. Total cost could be as much as the total requested IMI contribution. So if you can just send us the reference where you found this specific explanation, we will look into it.
Thank you. Another question from Joanna. Do BNRF, such as Swiss partners, sign the accession forms to the grant agreement or only the consortium agreement?
They do sign accession forms. They are part of the grant agreement. They do not receive IMI funding because they are automatically funded by the Swiss government, since they are not eligible under Horizon 2020 rules, but they are just like a normal partner of IMI, so they do access to the grant agreement.
And this actually relates to the next question from Vittoria Mastro Mauro, who asks to clarify the role and participation of Switzerland in IMI Calls. Obviously, Switzerland is now able to get funding from some parts of the Horizon 2020 program, but not the part that IMI is in. So you are unfortunately considered a third country.
But like I said, once the proposal is selected for funding, more or less it's automatically then covered by the Swiss government. We have many examples like this in IMI2. So the joke is that these are the free partners, because they participate, they contribute a lot, but their cost is not covered under the IMI1 budget, IMI2 budget. So then you have room to have other partners and budget for other partners.
Yeah. We have a question from Alexandros Nicolaou, who would like to know the average success rate of stage 1 proposals in IMI2. How many proposals do we receive per topic?
I don't think we have made recently a calculation, but it very much varies. Sometimes we have just one. Cases like that happen. Very often we have 3, 4, or 5. That's kind of an average lately, but we have seen as much as 10, 15, or even 30 in the past, especially in IMI1. So it very much depends on the topic. Some topics are much more specialized, and for topics which are more broad and cover some more popular research areas, then you can expect the competition to be a little bit more significant.
Okay, a question now from Luis Iranzo. In the presentation, you defined evaluation criteria for research and innovation projects. Are they the same as for the CSAs?
No, in the call topic text, there is slightly difference between RA evaluation criteria and CSA. So you will see at the very end of the call topic text, there is a section of call condition, and there are different evaluation criteria for research and innovative action and CSA.
And related to that one, I would actually refer you and also Michael Beer, who has asked the question as well, and I'll come to that in a moment. At the webinar on the CSA for Big Data for Better Outcomes, our science officer, Colin Carroll, did go through the differences with the CSAs in terms of things like eligibility criteria and the minimum number of participants. So I would suggest you go and check that out. So the question from Michael Beer, and maybe you can clarify.
Yes,
a few days ago, I'll just read it out so that other people can hear it. So a few days ago, the number of participants for the CSA call was said to be 1, and today we heard at least 3, which is correct. So maybe.
Yes, you are indeed right, your remark. So in this call for proposal, we have several research and innovation action and 1 CSA. So for research and innovation action, the minimum is 3 organizations from the 3 different member states or associated countries, while CSA, according to the H2020 rules participation, the minimum is 1. So for the CSA, you indeed can have 1 single applicant organization, but only for the CSA topic, not for the other one. But in any case, you have to consider the project objective of this specific CSA, so to consider if 1 is sufficient to meet the project objective. But you're right, the minimum eligibility criteria for the CSA topic is 1 entity from EU member state or the country, while for all other topics, being RIA, the minimum condition is 3 organizations from 3 member states or the country.
I would just add, I mean, we often get this question, how big should my consortium be? And of course, you do have those legal minimum requirements, which Fabrizio has just outlined, but as Magda said earlier, the important thing is to fulfill not only the legal requirements, but actually the practical requirements. You do need to demonstrate to the evaluators that your consortium has all the expertise you will need to fulfill the requirements. But equally, you need to do that without over-duplicating. I mean, one thing that can be problematic if a project is bigger than it should be, because obviously managing lots of partners, it can become unwieldy. So you need enough people to do the job well, but not too many so that you have duplication of effort. Another question from Angela Cree in Call 7 Topic 4, the FPA budget includes 80 something in cash. What should the SP budget include? This SP cash or just stick to the IMI budget?
So yes, indeed, in the call topic text, the FPI and associated partner in-kind contribution is $8,025,000, including an expected $6.5 million in cash. So there you have a description that the FPI cash contribution is intended to support achieving the deliverables of the work packages described in the call topic, including the conduct of clinical trials. So,
I mean, normally at stage 1 you should only allocate the contribution of the GU funding, because the additional contribution from FPI in cash will be done at stage 2 together with the FPI consortium, considering the expertise present in the consortium, plus the interest of the FPI company which is awarding allocating the financial contribution. However, we will confirm this should be addressed in the specific call topic text. Under the topic text, it should be mentioned. However, I think we should take this question and verify it with the SO in charge of the topic to double check and confirm this. So maybe, I don't know if you can follow up on this question in the list of questions.
Yeah, we will get it, yeah. So Joanna has come back and clarified where she found that reference to the question of estimated costs, and so it is in on Sophia, so we will look into that one.
Yes, just to maybe clarify a little bit, I think I remember this question coming up early at the beginning of IMI2, and this is indeed something left over from IMI1 program, where our reimbursement rate was 75%. So we have to just make this correction, just to tell you that because we've been so busy launching calls, we haven't made the time to actually make this little tiny correction. We simply overlooked it. So sorry about that, but we will correct that as soon as possible.
Okay. So that is it for questions that have come in for now. So if you still have questions, then I suggest you type fast. I would like to now just remind you that all of the material that you should need to apply to do a good proposal is online. You should read it carefully. If you have any questions after today, whether it's about one of the call topics or about our rules and procedures, then you should send it to us at info@imi.europa.eu. I don't see any other questions for now, so I will say thank you very much to Fabrizio and Magda for their presentations and for answering all the questions. Thank you to all of you for coming along to the webinar, and good luck with your proposals.